Hi, I'm Melissa Stocky, a nurse injector at Cynthia Gregg, MD, Face and Body Specialist, and we're here today to discuss our Patient Appreciation Day topics, which are going to cover what's new and upcoming. Andrea, last minute, could not be with us today because she has a new grandbaby coming, but we're very excited for her, and congratulations, Andrea. And we have Nina.
Nina Clark Christoph.
And I'm Megan Barrio.
So the first topic is Redensity. Now, this is a new hyaluronic acid filler, and this is going to be like a beauty booster. With this filler, we are going to inject it under the skin in what's called the papillary dermis. So it's right under the top layer of the skin. And what this filler does is it hydrates and it gives like a very dewy, glowy look to the skin. When it's injected in the lips, it's almost like a lip gloss for the lips. So this is going to be perfect for patients who don't want fullness to the lips, but rather just hydration. Redensity has been great in areas where there's fine lines and tiny wrinkles. So for example, let's say you've done your Botox and your lines are soft and smooth, but there's areas that are static or stubborn. We can actually take this Redensity and fan it under the skin and give it a nice little boost or hydration. It's kind of like a washing of the skin or an airbrushing of the skin. It's been quite nice. We love it. And it's new, and we're really excited to start doing it on patients. We have been doing it successfully. Yeah.
Mhm. I agree, Melissa.
Yeah.
And the other thing that we've been doing new with the Revance RHA portfolio is blending some of the products. So we'll take that first syringe, we'll thin it down with some saline, and we'll do that kind of fanning technique, oftentimes out through here. And it really does help
Yeah.
with those fine little smile lines that can be hard to treat. So that's something that you may hear of washing or blending
Blending.
the
Yeah.
products. The other thing that we've been doing is something called the glide plane stabilization that we use with this portfolio in particular. So we've known for years that we've been able to stabilize some of the ligaments to get more lift with fillers, not just volume, by injecting up on the cheekbone and on the jawline. But oftentimes there's another ligament we can take advantage of, and it's injecting back in this area that because as we age, we know that it's not only downward, but it's a forward rotation. So we're trying to take advantage of all the things that we can to give you the best results.
Agreed.
And a couple other new things that will be coming out that we're really excited to share is there's going to be a new neuromodulator that's just recently FDA approved called Daxi, and it has an FDA approval for 6 months duration. So we think a lot of people are going to love that. We hope that we'll have that in our office, hopefully by the end of the year. And then the last new thing that got FDA approved was in the Juvederm portfolio called Volux, and that'll be the first hyaluronic acid product FDA approved for the jawline, so to help chisel out that jaw. And same thing, by the end of the year, we should have that in our office, we hope. And then the last new thing I'd like to talk about is the addition of our new colleague, Megan Barrio. She's
Yay.
bringing her years of experience in the aesthetic arena to our office. So, Megan, share what.
Yes. I am so excited to be here. I actually worked with Andrea a while back and came here at the beginning of the year, and I'm just so excited to be part of this team and to be injecting with everyone. I could not have asked for a better position. So very, very lucky, very blessed, and looking forward to moving forward with practice. We have some other new things that we have found on social media that we wanted to mention. I know you talked about the chisel jawline. Some terms they're using is the snatched jawline. That's something that we do already do in the office, and it's something that we think is very pretty with getting that definition. And so we wanted to mention that. The other term that you might hear is a lip flip, and that's where we're using neuromodulators to help flip the lip and turn it up to see more of that pink. Looks really pretty, and we've been doing that for a long time as well, and just wanted to mention that. So when you hear these terms, they're great because I think it brings patients into the office
Yeah.
and they want to know about a new
Right.
term, but it's also things that we're doing already that we wanted to share with you.
Yeah, these are new trendy terms for old techniques. And we're just mentioning that because
Right.
when you see them on social media, um, we do them already in office, but we have been doing them for years. So
Hmm.
we're based on assessment, we can provide those results as well.
Yes. So we have a new technology, SoftWave, and it's ultrasound technology. It is another tool in our tool belt to help with tightening of the skin. You can do that in the jawline,
Mhm.
you can do that on the brow, you can do that on the submental area and also the neck. It's a quick procedure. It takes to do it all, it takes about an hour,
Mhm.
and you're in and out, very minimal downtime afterwards. So a lot of patients we found really like that ability after the procedure.
Great.
Yes. So thank you so much for joining us today, and we hope that we can see you soon. We have our number for you to give us a call and come in for a consultation. We look forward to it.
Thank you.
Thanks.
Thanks.